My name's Sara Wallace, and I'm in orthopedic surgery. I primarily do hip and knee replacements and redo hip and knee replacements, and I'm in practice at the University of Chicago in Hyde Park. I've been an orthopedic surgeon for probably close to 12 or 13 years now, and in my own practice, currently 6 years.
That's really cool. And then what made you choose your career path?
I chose orthopedic surgery because I had some great mentors during medical school who kind of geared me down the route of surgery and more of a hands-on type career. But before I got into the operating room, I was interested in medicine since I was really young and had both some experience as a patient when I was a child and then had some family members who were practicing in different areas of healthcare, not necessarily in medicine, but they all encouraged me to pursue a path in a medical field. When I got into medical school, I thought I was going to go into the world of infectious disease, but very quickly realized that I was sort of more of a doer or a hands-on type person rather than the medical practice side of things. So that's how I moved into the surgical side.
Okay. And then were there any specific moments in your career that really inspired or motivated you?
Oh man, yeah. I mean, there's moments on a regular basis, I think, that serve as ongoing inspiration and help to keep you coming back on a daily basis. Life in surgery can be sort of long days and can be challenging at times, but when patients do well, which in joint replacement almost always they do. They're very grateful, and being able to give patients their quality of life back and give them autonomy and independence, particularly as they get to be a bit older or later in life, is really rewarding, and patients appreciate it even more so than life-saving surgeries, I think, at times. If you give patients back their quality of life and take away the pain that they live with on a daily basis, they're extremely grateful and it has a huge impact.
Yeah, that's great. And then were there any specific people or mentors that had a significant impact on you?
Yeah, well, like I said, in medical school, I was partnered up with one of the spine fellows that was sort of still in training at the time, who encouraged me to get my hands on in the operating room and kind of run with it. And, I think all of the residents in the orthopedic surgery department at my home medical school were all very encouraging. And even though I might not really look like your stereotypical orthopedic surgeon, I didn't even really realize that until I was into my own residency, just because no one ever brought it up and everyone was just always very encouraging and let me know that it was a path that I could pursue and I could do successfully. Yeah, as far as sort of life mentors, I think they come in all shapes and forms. I have a mentor for research and I have mentors for work-life balance and mentors to ask surgical technical questions to and sort of just practice management questions too. So I've had many, many mentors along the way and still do find a lot of value in mentorship, both among my peers. I still communicate with the other surgeons that I trained with, both in residency and fellowship, and I talk about life and careers and cases with those practicing surgeons all the time. They're really at my peer level. And then I continue to talk to faculty that I worked with in my fellowship and sort of send them cases and, hey, what would you do for this hip or this knee? What are your go-to moves to kind of get through this sort of technically challenging case with a bit more ease? So, I think just building that network of mentors along the way is extremely important, because you're not going to have one mentor that can cover all the bases. I think equally important, but oftentimes overlooked, is having people that really promote you throughout your career. So mentorship is, of course, really valuable, but having someone to promote you and boost your name and say, hey, I think Sara Wallace would be great for, this course or to get involved in this project, that's really, really valuable as well. And I think sort of harder to come by.
Yeah, okay. And then when you initially entered this field, were there any struggles that made you reconsider your career choice? And if there were, how did you push through that?
No, I mean, I don't want to be dismissive of the question, but I don't think that I've ever second guessed my career choice since the day that I sort of decided to apply to orthopedic surgery. It's just a ton of fun on a daily basis, and you work with other surgeons who really love what they're doing. And I think as a field, orthopedic surgeons, we're really happy people, and we really do enjoy the day to day of it. Of course, there are elements of practice not specific to orthopedic surgery that can be challenging at times, such as limitations of being employed by a hospital system with its own rules. You know, the hospital has rules that they might impart on your schedule or what have you. But, those are sort of more logistical issues and less challenges of the day to day. I think it's not easy to find the right balance in your personal life and your career when you are in a surgical subspecialty. And I don't really think that there is such thing as really like a true balance. It's just constantly making adjustments and realizing that what worked for you last month might not work for you this month in terms of scheduling and family life and everything. And having a partner who's understanding of that and willing to sort of be flexible and work with you on what both your work and your home life might look like, and having a supportive employer and department and chairperson who support you in both your work life and your personal life and your own mental well-being. I think that's extremely important, and really the primary drivers behind the relationships that I have now, both with my partner and with those who I work with and work for now in the current hospital system that I'm in. It's just having that level of understanding. I have two young kids. I have a 3-year-old and a 6-year-old boy. And so managing their schedules and working with our nanny and with my husband to balance out their busy lives and make sure that they're happy is a full-time job in and of itself. So everybody needs lots of help when you have a full-time career and a full-time life at home. And I don't underestimate the help that I get doing that on a daily basis.
Yeah, okay. And then, if any, what kind of adversaries have you faced because of your gender or background?
I think I was really fortunate early in my training to really not experience much, or at least maybe I'm just of the personality where I didn't notice any sort of gender discrimination when I was in training. I don't know which it is, or maybe a combination of both. Maybe I was lucky to just not experience a lot of adversity with regard to my gender, that, women are the minority in orthopedic surgery. The percent of practicing orthopedic surgeons is like around 7% female right now. The percent of trainees is slightly higher than that. But so I'm definitely in the minority in that sense. But along the way, I didn't perceive that as being necessarily a barrier. Everybody always asks about the technical aspect of joint replacement. Is it challenging? Does it require strength? Is it something that's feasible for women to do? And I think obviously without a doubt it is. I mean, I'm one of many practicing female orthopedic joint replacement surgeons in this country, and I think we all do it well and probably in a way that is arguably smarter than some of our male colleagues who may use brute strength to try to get through the case. I think it's more about technique and being smart about your body mechanics, and I think that most surgeons realize that at some point in their practice regardless, but maybe for female surgeons just realizing it earlier is reality. But I think that the biggest challenge that I experience is probably bias from patients who either are expecting to see a male surgeon and are surprised to see a female surgeon, or maybe who are expecting to see someone with gray hair, an old white male with gray hair, and then they see a young woman when they come to clinic. And I don't think that it's usually a problem, but certainly it does catch some patients off guard. And I think that at certain times patients, because they're caught off guard, don't necessarily know how to interact or feel that they need to interact in some sort of different way with me because I don't look like what they anticipated. And I can remember a handful of times when I was in training working at, for example, the Veterans Hospital, where it's predominantly older male patients. And there were certain times when there were inappropriate comments made. But, I just think that for me personally, kept in mind the fact that we're just here to try to help the patient, and that's what this is really about. And all personal bias one way or the other from me or from the patient aside, if you just keep that in mind, that you're here to help the patient and that's the patient's goal as well as to achieve whatever their health goal is, then there's no point in wasting time thinking or worrying about what other biases might be contributing to the interaction that you're having. So yeah, I don't feel like it's really been a limitation for me, and I'm fortunate in my current position to be surrounded by an abnormally large percentage of women in practice. And I'm in an environment that really supports diversity in our practice. And that's one of the reasons I'm where I'm at.
And then why do you think that diversity in a workplace is important? And like in particular, gender diversity?
That's a good question. I'm trying not to answer it in a sarcastic way, but usually I would say that obviously women have like better ideas and think in smarter ways than men do about most problems in life. But I say that sort of jokingly. I think that everybody, regardless of whether it's gender diversity or other forms of diversity, everybody comes to the table or approaches a problem from a different perspective. And if you want the best solution to whatever the problem is, you need to see that problem from all 360 degrees from all those perspectives. And that's true in healthcare, and I'm sure it's true in any field. And I think that the institutions, the hospitals, the businesses that recognize that are the most high-performing and successful groups out there. So yeah, I think just diversity of thought is extremely important. And then on top of it, in healthcare specifically, I think having a workforce or a healthcare workforce that is reflective of the patient population that's being treated is extremely important, and it helps to foster trust with patients and their providers and builds a better relationship with the community. So, for example, in orthopedics, most patients with arthritis, or like something like 60% of patients with hip and knee arthritis, are female. So it doesn't make sense to have a group of surgeons who's predominantly male when the patient population is predominantly female. And similarly, practicing in Hyde Park on the south side of Chicago, most of our patients are not white, and so it doesn't make sense to have a workforce or a group of healthcare providers that is predominantly white. So I think just trying to mirror the population that you're treating and help to achieve trust and balance in that sense is certainly important for healthcare. People oftentimes think of surgery as being something that's just so technical that the way the surgeon looks or their background or their way of thinking may not be as important, but I would argue the opposite. I think that for patients who are contemplating the possibility of undergoing a major surgery like a hip or knee replacement, those patients need to have a whole lot of trust in their surgeon and their entire care team in order to really successfully get through that process. And the technical aspects of the surgery are probably just a very small percentage of what matters about that patient's care. And the rest of it probably has a much more impactful presence, particularly from the patient's perspective.
Yeah, okay. That was really insightful. And then what do you perceive to be the largest barrier or obstacle to like girls becoming orthopedic surgeons?
I think that they just don't know how awesome it is, honestly. I think that maybe it's just not a field that women are exposed to or fall into as readily as males who may see other peers or other surgeons before them, who look like them or who might encourage them to consider orthopedic surgery. I think for women, there's just a lot of assumption that women are interested in maybe pediatrics or dermatology or something that's traditionally felt to be more of a female dominated field, when in reality, I think that if most women who are interested in medicine were exposed to orthopedic surgery, they would probably think it's just as cool as I do, So I think it's really just exposure. So there's programs out there that are trying to create earlier exposure to women in orthopedic surgery and also just to sort of other minority groups in orthopedic surgery so that people can find out what it's about and kind of how fun it is on a daily basis. There's the Perry Initiative for women who are interested in pursuing orthopedic surgery or finding out more about it. Our institution in particular participates in something called Ortho Reach, where we try to get members of the community who are in high school or who are early on in exploring their career options to spend a day doing the type of things that we as orthopedic surgeons do and just finding out more about it. So I cannot underestimate, the importance of that type of thing, just so that those who may not have exposure to it and who may not even have it on their list of options can at least put it on the list and check it out and see how fun it is to be in the operating room with us.
And then you mentioned that you had a few challenges with patients, but like what traits do you have to help you deal with that challenge? And also, how would you suggest someone cultivate those traits?
Think everybody has their own way of relating to patients. I don't think there's one right way or one group of traits that you necessarily need to have, but I think it's just person to person relationship type skills that will help you succeed in anything. So for me, I mean, I tend to be a very straightforward person, and I think patients appreciate that when it comes to their health care. So I can see, for example, if a patient's nervous and is making all sorts of jokes, I'm happy to go along with that, but I will always kind of bring it back to the point and say, I know that you're here to really talk about your hip, and here's your options, and just lay it out there. Here are your options with your hip. You can do this. You can do options A, B, or C. And the ball is in your court, and I'm here to try to help you and give you my advice, but this is really the way I see it, and kind of like a take it or leave it approach. And I think that patients really do appreciate us being straightforward with them about what their options are. And I think that goes a long way, because I think a lot of times patients who maybe are more apprehensive about seeking surgical care, or who may have had fewer touch points with healthcare in general, oftentimes they're really skeptical and maybe are turned off by kind of like maybe somebody who comes across as more of a salesman. And instead, rather than trying to sell patients on one option or another, I think just giving people the facts is something that they really respect. And so I try to do that. I try to give patients the facts, and I don't sugarcoat it. And I tell them kind of what the risks of each option are, and what the risks of surgery are, and what the likely outcomes for them might be, and let patients make their own decision about what the best treatment options are for them. So I think being straightforward and honest with patients really goes a long way in gaining their trust. And I think also just giving patients the floor when patients come to the office and want to talk about their hip or their knee or whatever it is. I think giving them the opportunity to just say what they want to say about it and kind of tell their story also goes a long way, and is really actually extremely useful as a surgeon. Patients will tell you exactly what's going on, and if you just listen to what they have to say and what their primary concerns are, you can really get to the bottom of it and tell them what the best options are much more quickly than if you try to direct the conversation as the healthcare provider. So I guess those are some of my strategies, but just being like a real person and offering the opportunity to allow them to talk, tell their story, and ask questions, I think goes a long way.
Yeah, okay. And then do you think it's important for a high schooler to like consider gender balances when selecting a career, or like how much weight would you put on that aspect?
I didn't even consider it, so I'm obviously really biased in one direction, but I don't think it matters whatsoever. I mean, I really don't think it matters. There's so many different types of diversity. It's not just about gender, right? Even if you went into a field that was female dominated, I think you could find yourself among a group of women who you had nothing in common with, and who you didn't relate to and didn't share the same goals with. So I think it's more just about finding your groove and whatever you are into and whatever you want to spend your life pursuing. I think you just need to find people with those same priorities and goals, and that's what creates a good team. You don't have to necessarily look like or be in any way the same as your team, aside from just those shared priorities and shared goals. I think, of course, there is something to, being around other women and women supporting other women. I think there's something to that, but I don't think that's all that it's about. And the reality is that a lot of more highly subspecialized careers, and particularly the higher up you get into whatever your career and field might be, is predominantly male dominated still, in most areas. So I think that shouldn't stop you. And I think that at least I feel fortunate to be in practice in a time when other women have certainly done a lot more of the hard work before me, paving the way and showing both patients and their colleagues that women can be just as good or even better surgeons than males. There was actually a study that came out of surgical literature in the last year that showed that female surgeons actually have better outcomes than male surgeons. So, it's kind of sad that it takes that kind of research to change people's biases, but I think that it is changing. And I think that depending on your practice environment, you might find yourself among a lot of women or a lot of people who look like you or have similar backgrounds to you. And that's, like I said, that's great, but I certainly wouldn't choose your career based on that. And I don't think, at least in medicine, I don't think that you would ever encounter any sort of a hard stop or barrier to the point that you would say to yourself, this hasn't been worth it or this is a losing battle. I've never felt that way. And I think that that will only improve as time goes on.
And then just for a final question, what advice would you give to other women who want to enter your career field?
Well, starting off from the time point that you're in high school, I think don't set yourself down a path that you are not willing to change. So, maybe in high school you decide that you want to be a cardiothoracic surgeon. I think if even 10 years down the road you decide that that was not for you, I think don't be afraid to change your mind along the way. I mean, that goes for people who are in practice too. Like maybe you do go into orthopedic surgery and 5 years into your career, you think to yourself, I hate doing this. I've never heard someone say that, but you say you find yourself saying, I hate doing this. Don't find yourself pigeonholed into something where you feel like that if you change your career path, you've failed. I don't think that's true at all. And I think that most areas of healthcare offer the opportunity to pivot and either go from healthcare practice into administration or into education or research. So I would say, for one thing, just keep an open mind about your path along the way and realize that even if you make a turn or change direction, that's not necessarily a sign that you've made a mistake or been misguided. I think your career should be thought of as something that's fluid and that would be expected to change throughout your lifespan. And I think those are the people who are happiest in practice that I see. So that's one thing. And I would say just get early exposure to everything you can. It's easy for me to say because I'm around it all the time, but most of us are really open and willing to have people come and shadow us for a day or do something like this, do an interview and just get exposure to everything you possibly can and everyone you possibly can and ask the questions that you're asking. Why did you go into this field and how has it been and would you do it again? You'll see probably really different responses from people on questions like that. So I think obviously the academics side of things is really important if you want to go into medicine. It's the residents that get accepted into our training program now, I always say, are much smarter and more qualified than I was when I got in, and I probably wouldn't get in now if I applied again. So it is competitive, and that's not to be underestimated. So the academics is sort of something that's a given. You have to be at the top to get into a subspecialty surgical program, but those are my top recommendations.
So that's all the questions that I have for today, and thank you so much for meeting with me.